Good afternoon, everyone. It's my pleasure to thank you for attending this short in-service training on maintenance and calibration of ion selective electrode ISE SFRI 6000 analyzer. As we all know, maintenance and calibration are two critical factors, along with the proper quality assurance program that will enhance production of reliable results when analyzer is used for laboratory analysis. At the completion of the training, medical laboratory scientists will demonstrate 100% proficiency in the maintenance of the analyzer for optimal performance of the equipment. Medical laboratory scientists will also be able to perform calibration with minimal supervision all the time and improve efficiency of the machine to produce accurate and reproducible results. Ion selective electrode 6000 is a stand-alone electrolyte analyzer that measures sodium, potassium, chloride, carbon dioxide, pH, total and ionized calcium in plasma, serum, and urine samples. This piece of equipment uses manometric principle for the analysis of CO2 and potentiometric principle for the ions and anions and pH measure. When the instrument is turned on, it will carry out self-test for sample probe position, printer, and auto sampler. The sample probe will be lifted up and the screen will display position OK, printer OK, auto sampler OK. For the maintenance, there are four major components or areas that require daily maintenance or inspection, and they are wash station, sample probe, tubing system, electrode, and electrode solution. For the wash station maintenance, remove the wash block to expose the wash station and confirm the tube supplying cleaning solution is not leaking or blocked. If it is leaking, fix properly. If blocked, take out the rubber and clean with the cleaning solution, then replace the wash block. For the sample probe maintenance, on the menu, press back. The sample probe will rest on the wash station. The outside of the probe is wiped with 90% alcohol. If the sample probe is blocked, move it to the top position by pressing run on the menu. Take the probe out and remove the blockage using a thin 2cc syringe needle with cleaning solution. For the maintenance of tubing system, the first thing to do is to open the sample probe case to check the aspirating speed and volume of the sample and be sure there is no blockage or leakage. The normal condition is a long section of air followed by long section of fluid. Presence of bubbles is an indication of loose tubing connection. Locate and reconnect the tubing. To maintain the electrode assembly compartment is opened and the flow inside the electrode assembly is checked. Also, the electrode solution, which should be 2/3 full, is checked. If not, it is filled up. There is need to also check if there is salty crystal deposit on the electrode. If so, this is removed and cleaned with wet tampon. For the calibration of the equipment, there are three possible options. 1. Self-calibration. 2. Automatic calibration. 3. Manual calibration. For self-calibration, when the instrument is turned on, The system checks the positioners, voltage, pump, pulse numbers, and the electrode potentials. When the calibration is complete, the screen displays slope with the following parameters: potassium 57.1, sodium 53.3, chloride 48.8, calcium 21.6, serum pH 41.4. If the slope of an electrode is unstable, it will display fluctuation. If the slope is abnormal, it will display X instead of OK. When self-calibration fails and systematic error exists, calibration is carried out either manually or automatically. To carry out auto-calibration, from the main menu, press Others. The screen will display calibration with the options of manual or auto. Press Auto. Then enter target values for all the parameters of interest one by one and press Yes each time the values are entered. When all the target values are entered, press Cal. The screen will display Run. Then place the calibrator under sample probe and press Run. The instrument will aspirate the calibrator and analyze it. After a few moments, the screen will display calibrated values. This calibrated value is actual measuring values multiplied by current factor. After the calibration, the screen will display new factors. Run control sample to confirm if the calibration is correct. On the other hand, if manual calibration is preferred, press Manual from the menu and it will display the slope and the intercept as shown on the screen. Select the item to be changed and the screen will display where to change the slope. Enter the new slope values, which is A, and press Yes to save. Then the screen will display where to change the intercept value, which is B. Press Yes to save. In this menu, you can change manually the calibrator. As I conclude this presentation, I would like you to know that proper maintenance and accurate calibration are essential for accurate and reproducible results. Please always remember that your results provide vital information to requesting physicians for appropriate diagnosis, effective treatment, and efficient monitoring of patients. Mastering how to maintain and calibrate the analyzer along with quality control measures will assist you to discover any deficiency in the analyzer that will ultimately affect the patient's results prior to processing patient samples.